Welcome back. It's Dr. Kyle with Project Wellness Company with my good friend Scott here. And what I want to do today is I want to talk about a subluxation, what we actually do when we're adjusting the spine. And in a moment, I'm going to actually go through and adjust Scott. Scott is an active runner. He's got a half marathon this weekend as a part of a half Ironman team, and then another half marathon the following weekend. So keeping his body in tip-top shape, super important, making sure his hips are moving and he's subluxation free. Now, what a subluxation is by definition is you've heard of a dislocation where the bone completely comes out of that joint. And what a subluxation means is sub, which means below. So the bone moves within that joint, but it's not in its normal location. Dislocation is when it completely comes out. A subluxation is where it's misaligned within that joint itself. And when we look at the spine, there's a lot of different ways that can happen. And when it's subluxated, that pressure and that rotation of that bone, okay, which is what we're evaluating for before we adjust, and then when we adjust and find that subluxation, it's taking pressure off the nervous system. So it's going to affect where that nerve is going. Now, one of the most common complaints or issues or concerns, I guess I would say, that we have is the noise. And I want to talk about the noise. Have you ever opened up a bottle or a soda pop and it makes a noise? That's under pressure. And the same thing happens is when the bone is subluxated, it causes more pressure. And so when we adjust the bone, we're releasing that pressure and it creates that noise, which is ultimately just gas release out of that joint. Perfectly harmless, but when it's between your ears, it's going to sound really loud. As it gets further down in the spine, we may not even hear it because it's literally feet away from your eardrums and what you would hear. So I'm going to go ahead and get Scott, check and evaluate Scott and walk through what the adjustment would be. Okay, just go ahead and lay on back. Now, within the office, on any given day, we're going to use 7 different techniques, and they're all specific to the patient and what they have going on. Some patient, due to a structural change within their spine, within their body, is only going to respond well to a certain technique. Or if we have concerns, which is like osteoporosis, the bones that are weakening, things like that, I'm going to use a really low impact adjustment for the specific patient. So my technique may change if we adjust a baby, and yes, we adjust kiddos. The earliest that I've seen one is literally minutes after they were born. So adjusting from cradle to grave. So different techniques depending on that individual. So when we check specifically in Scott's spine, what I'm looking for from left to right is, does he have a misalignment, that subluxation where that bone's not sitting where it's supposed to be. And the technique that I'm using his neck is a diversified technique where we rotate his neck to the side. Okay, so we're locking that joint out. Okay, and the easiest thing to do is then I have Scott just slightly look towards his left, and the spine's ready to be adjusted. The bone is moved, pressure off the nervous system, no harm to Scott, feels perfectly normal. His body's actually communicating, okay? Evaluate after to make sure that bone has done what it needs to. Okay, if there's any remaining ones in there, we'd clear those out. Nice and simple. Okay, go ahead and turn to your stomach, Scott. Now, when we're evaluating the mid-spine here, a lot of things that we'll see, okay, is compensation from side to side, where the muscles on one side can be tighter than the other. And I know from working with Scott in the past, okay, his first issue was down in the low back, what finally brought him into the office, and he had a lot of imbalance of these muscles down and through here. And when we're motioning and checking, okay, he's got more of a buildup on his left than what he does on his right, okay? So with the adjustment of itself, okay, that's one of the things we're looking for. Is there restriction within that joint when we challenge that joint? Okay, is there that rotation in through there? So I'll just have Scott take a nice deep breath in and all the way out. There we go. And then to clear this hip out, I'm gonna have him lay on his left side first. So then when we set Scott up to the side, okay, we get tension here, traction in the spine here, pulling him into us. Slight into the spine moved great, body's moving well. So that's gonna free his hips up. And the important thing for him with his low back is when he's running, making sure both hips are freely moving. Okay, we're getting good motion on those hips and the low spine is doing what it needs to. When there's restriction in through there, there's gonna be an imbalance, which will affect his gait all the way down into how he's running. So his performance is super important for him to get the time that he wants. So making sure that his low back, his hips, all those things are communicating. The brain's communicating with those different parts to make sure there's no pressure on that nerve so the body can do what it's supposed to, and it has no restrictions to be able to perform at its highest.